Good evening, friends. Welcome to the PANSIGHT webinar. Let me start the slideshow. Today's topic is dangerous doctors. And some of you may be wondering, why did I choose this topic? I myself am a doctor, and I have been practicing medicine for more than 50 years. I worked in India, in United Kingdom, and the USA. I had the opportunity to work with and closely observe hundreds of doctors in the past 50 years. And from my professional experience, I know that there are many doctors who are really dangerous. I'm going to share some real life stories that will help you identify or recognize dangerous doctors so that you can protect yourself. So purpose of this talk, how to identify dangerous doctors, then how to protect yourself from dangerous doctors. My webinars are always based on FEQT, facts. I'll be sharing facts, whole facts, nothing but facts. Yes, I take a lot of efforts to make sure the facts are real, they're genuine. Those facts will give you a lot of insight. Then experience, my own professional experience, quotations, lastly, thoughts. The interpretation of the facts and my conclusions. There are some books on dangerous doctors. Deadly doctors. Don't let your doctor kill you. Yes. Yes. Instead of saving your life, some doctors may kill you. They're going to see how. Word dangerous means anyone who can cause harm, or anything that can cause harm. Old proverb, the doctor is often more to be feared than the disease. Absolutely true. The disease may not kill you, but the doctor will kill you. I'll share real life stories. This in America. Medical error is third leading cause of death in US. According to many authentic reports, including the report from the BMJ, more than 200,000 patients in a year, they die because of medical errors. It's not a small number. If this is happening in the USA, the population of 33 crores, what about India? 140 crores. Definitely, there's no auditing. We don't have the actual numbers. My guess is easily more than 1 million patients every year. They die because of medical errors. This fact, I would like you to remember. Number of medical colleges in India rose to 731 from 387 in 2014. J.P. Nadda, the health minister. That is a 82% jump in the number of medical colleges. So why should one worry? Question is, why should one worry? You should feel good. Yeah, more number of doctors, better healthcare. Now comes the facts. I'll share those facts later, or explanation. Five traits of dangerous doctors: greedy, unethical, incompetent, negligent. Lastly, impatient. Greedy and unethical. They are like twins. The question is, I have heard many people saying that, oh, doctors these days, they are all very greedy. Hospitals, they are greedy. The question is, why? What is the root cause? For getting a BTech, that degree, qualification, to become a software engineer, you need to spend only some 3 to 10 lakhs. Even some of the IITs, you can complete the course by spending 10 lakhs. But what about MBBS course? Do you know this authentic fact? SRM Chennai and Amrita Institute in Kochi. You'll be shocked. You know the money required to get MBBS by studying there. Up to 1.25 crores. 1.25 crores as a general category. For NRI quota, it comes to close to 2 crores. And many middle income families, because of the parents, mostly it is the parents, they want their children to become doctors. They send them for coaching, NEET or whatever it is, and then after spending 2 or 3 years, then they get admission, they spend this much money. Where does the money come from? They borrow from the banks, or they sell some property. Then what happens? So with MBBS, these days, nobody practices that MBBS qualification. With BTech, yeah, you can. But MBBS, not enough. Then you need to go for MD or MS, another 1 to 2 crores. So by the time that person has got MD or MS, already spent more than 2 to 3 crores. Which is from the bank, borrowed from the bank, interest, by way of interest, every month they will have to pay 1.5 to 2 lakhs. How much do they get when you go to private practice? The fact is, I told you, facts, nothing but facts. But they'll be able to get 75,000 rupees per month to 1 lakh. But they have to pay an interest of 1.5 lakhs to 2 lakhs. Tell me, my dear friends, when will they be able to pay off that debt? So they are in debt trap. Significant number of them, especially those who go to the private medical colleges. And as I told you, the number of medical colleges has jumped from 387 to 731, 82% jump, mostly private medical colleges. Very costly, expensive. So they need to make money, generate money. What do? They will order all sorts of unnecessary investigations so that they will get a kickback. CT scan when it's not required. For ordinary mild headache, CT scan. MRI scan. Some abdominal pain, ultrasound. For fever, all sorts of investigation like dengue, chikungunya, swine flu, COVID, monkey fever, Nipah. Yeah, when you go to a hospital or multi-specialty hospital, corporate hospital, when they order all these tests, they test 3,000 to 5,000 rupees. The family of 3 people, when they go, it is going to cost 15,000 rupees. And most of the tests will be negative, my dear friends. Even today, more than 95% of the fever. You don't need to do anything. You don't have to worry. Just a couple of days of rest. Drink more warm fluids and eat rice kanji or some bread or drink tea. If the fever is slightly more than 100, take one paracetamol tablet. You'll be all right. That's what we did when we were young. But now it is not like that. The moment somebody gets fever, they immediately run to and see a specialist and a big hospital. Yeah, they are worried whether it is a COVID, whether it is a dengue. You have to shell so much money. And the doctors order all those tests because you know how much kickback they get when they order all these lab tests. The doctor who is ordering, they may get anywhere from 20 to 30%. Suppose you are paying 3,000 rupees, the doctor gets up to 900 rupees. CT scan, up to 50%. MRI scan, up to 50%. Now you understand why. Why they order a lot of unnecessary investigations? Because they have to take care of their debt. Who will pay their debt? So they engage in unethical practice. Unethical is ordering unnecessary, costly investigations. Then when all the tests are negative, you have spent 5,000 rupees. It is not monkey fever. It is not dengue. It is not chikungunya. It is not swine fever. It is not COVID. Then the doctor prescribes an antibiotic unnecessarily. Because if you say, you don't need to do anything, go home and take rest, patients will be upset. Why? I spent 15,000 rupees. So they give antibiotic. And antibiotics have, a lot of antibiotics have significant side effects. Some people may develop diarrhea. Some people may develop itching. Then they go to get treatment for the diarrhea. So a fever which required no treatment, people go to the hospital and see the doctors, and now they get a new disease because of the antibiotic. So that is what is happening. And these doctors, they are desperate. So that greed and unethicality are because of their debt. Then negligence and incompetence. Significant number of doctors, they are incompetent. They don't update their knowledge. They don't upgrade their skills. I'm going to give a real life example. When I was working here, my supervisor, who is also a board certified physician, her incompetence, I'm going to share that real life experience. One day I was on leave. So that day, one of my patients walked in with a complaint he was having burning sensation when he was passing urine. So my team nurse, she ordered for a urine test and a blood test. When the lab results came back, she contacted my supervisor because I was on leave. And my supervisor reviewed those lab results. And what did she do? She ordered Septran, which is an antibiotic, for 1 week. And she asked the nurse to order for a culture and sensitivity of the urine. On the next day, When I went to work, the nurse showed me those lab results and asked me to review. When I reviewed the lab results, I was stunned. The urine showed no evidence of infection, no pus cells, and she had prescribed Septran, antibiotic, incompetence. And the patient's lab test, blood test showed the creatinine. That is a test to show how the kidney is functioning. That is abnormal. Creatinine level is high. And the Septran should not be given if a patient's creatinine is high. That can lead to kidney failure. And the urine showed some RBCs. RBC means red blood cell. That is blood. And she didn't do anything for that. The patient should have been referred to a urologist for assessing why there is blood in the urine. Patient should not have been given antibiotic. No culture. So what did I do? I immediately asked the nurse to contact the patient, ask him to stop that antibiotic. And I ordered for a urology consult. So I think that is this one example is enough to convince you that there are plenty of doctors who are incompetent. They have all the qualifications. And they are negligent, careless also. They are dangerous doctors. If I didn't stop, if the patient took that Septran, that person might have gone into frank kidney failure. Oh, this is happening every day. And impatient doctors, my dear friends, impatient doctors are dangerous doctors. If a doctor doesn't have the patience to listen to you, take a good history, believe me, they will make wrong diagnosis. They will order unnecessary investigations. A doctor who is patient and takes a good history, 90% of the, or more than 90% of the time, the diagnosis will be made based on the history itself. You may not even need any lab test. So I see plenty of doctors that are very impatient. Then you may ask the question, what about you, Dr. Reddiar? Are you patient? Oh, yes. Oh, yes. In the USA, the patients, they can nominate a doctor for customer service award, exceptional customer service award. I happen to be the only doctor in my hospital where there are 40 doctors who received the highest number of nominations for exceptional, excellent customer service. Many patients commented, Dr. Reddiar is a very good listener. And I was, on particular year, I received $1,000 as an incentive for my listening skills. I never ordered, and I don't order unnecessary investigations. I listen. Most of the time, good listening will be able to get the correct diagnosis. So if a doctor is a poor listener, that person is a dangerous doctor, avoid that person. The purpose of my talk is to how to identify, then avoid dangerous doctors. So don't tell me, hey, you are saying about the dangerous doctor, what should I do, or how do I know who is a dangerous doctor? And then again, find out whether that person went to a private medical college and which medical college. Then you know that person already in debt. Avoid that doctor. The doctor had gone to a government medical college, like 80% of the time, they are not greedy. Again, 20% of the doctors, still, they can be greedy. But 80% of them, they won't be greedy. But the private, no. and look at their lifestyle. That doctor is having a very palatial house and a car, Mercedes-Benz, BMW, and having iPhone. Be careful. You are funding for his that luxurious lifestyle. You are funding. Then 4 types of medication errors or harms. Wrong medicine. When the diagnosis is wrong, they'll be getting wrong medicine. Just like what happened to that patient. He didn't have any urinary infection. He was given Septran, wrong medicine. Similar thing happened to one of my uncles. Long time back, when I was a medical student, my uncle was a very thin person. He was thin. He didn't have any other significant health problem. Once he went and saw a professor of medicine for cough, a cough which has been lingering for some 3 or 4 weeks. That professor, without even getting any chest X-ray, he diagnosed tuberculosis, TB, and he prescribed streptomycin, an antibiotic, which he had to take for nearly 2 months. Streptomycin, one of the toxic effect is can damage the nerve inside the ear. Damaged, cause irreversible damage to my uncle, right? And then he was not able to walk, his balance, everything unsteady. And he developed severe fear. He became disabled and homebound. And after a few years, because of depression and all those, he committed suicide. The wrong medicine, so this serious. Wrong dose. Polypharmacy. Yeah, the risk is, my dear friends, so please, please, please don't consult most of the specialists. If you go to for headache, neurologist. For abdominal pain, gastroenterologist. Then diabetes, or go to an endocrinologist. So many specialists. They prescribe sometimes the very same medication, a different brand name. You wouldn't know. Ingredient is same. Brand name is different. And that will lead to overdose. Toxic side effect. Polypharmacy is, by definition, if a patient is taking more than 5 medicines, that is polypharmacy. I have seen plenty of patients back home taking 10 or 15 medicines. There's no need to take multivitamins. Plenty of people are taking multivitamins, then antioxidants, aspirin again, routinely, vitamin E, zinc. More number of medications, more harm. Polypharmacy. So the drug-to-drug interaction. Drug A will act against the drug B. So they interact. They cancel the effect of the other drug. And sometimes they make it more harmful. Take home message. Go to a general medicine doctor, an MD. And a doctor who is not very busy, who is not part of a big multi-specialty corporate hospital. And you will be able to spend at least, say, 15 minutes listening to you. You will be safe. If you got a headache, go to a neurologist, yeah, what will you do? You will immediately order a CT scan or MRI scan. My dear friends, the CT scan is not safe. One CT scan, the radiation is more than the radiation of 100 X-rays. Radiation, they can give their own side effects. If you go with an abdominal symptom, oh, gastroenterologist, he will pass this. the tube endoscopy, and you will do ultrasound. All procedures. If you go with a chest pain to a cardiologist, what will you do? Oh, immediately. You'll do you'll do EKG, ECG, then treadmill, echocardiogram, angiogram, angioplasty, standing. I'm going to show you another the coming slides. Unnecessary angioplasty and the standing done by the cardiologist. Unethical and greedy. Even in the USA. A white doctor once wrote, can you read that one? Illegible. There are some doctors who write very illegibly, prescription. And the pharmacists, they may dispense wrong medicine because they are not able to read. Such doctors are dangerous doctors. They should be punished. Such doctors, ask them to write a check. Suppose you ask them to write a check for you, 5,300 rupees. They write it very legibly. The banks, they will be able to read the number 5,000 clearly. No confusion. But when they write a prescription, yeah, illegible. Just like the chicken scratch. Such doctors are dangerous. One of the first duties of the physician is to educate the masses not to take medicine. Who said? Sir William Osler, father of modern medicine. And another quote, listen to your patient. He is telling you the diagnosis. But these days, what do you find? Doctors, you go there immediately. Bunch of medications. They immediately prescribe 1, 2, 3, 4, 5. And sometimes the patients are also happy. They have become addicted to taking pills, medications. My dear friends, I never used to prescribe unnecessary medications. Most of the time, I used to advise diet modification. Food is medicine. Food is medicine. Vitamin A, take papaya or mango, eat. Vitamin C, gooseberry or orange or lime juice. Food is medicine. I don't take medications. I'm not on any multivitamins. The only vitamin I'm taking because here, sunlight, you don't get enough sunlight. So I take vitamin D, that's all. Nothing else. I am in pretty good health. And I exercise every day, 30 minutes of brisk walk. I don't go to any gym, do any weightlifting. You don't need 30 minutes of brisk walk. Many people unnecessarily go to the gym and lift weight and then sprain their shoulder. Then they go to an orthopedician. All those things, my dear friends, don't do all those things. Just walk for 30 minutes. That's all what is required. If you have learned yoga, yeah, practice yoga. That's also good. Look at this. I told you facts. Facts. Taxpayers spend over 800 million for unnecessary coronary stents a year. Report finds. That's in USA. What about in India? Overuse of stents in cardiac patients need to be arrested. In New Delhi, in Ram Manohar Lohia Hospital, 2 senior cardiologists were arrested. 2 senior cardiologists were arrested for doing many unnecessary procedures and getting the kickback from the stent manufacturers. For a stenting, yeah, usually they charge 50,000 rupees or 1 lakh. And they get some 20 to 30,000 rupees by way of kickback. Unethical, greedy. What happened during the COVID period, COVID pandemic? In Trivandrum, there's a corporate hospital. Before the COVID, they used to do 100 to 150 angiograms every month, and 40 to 50 either angioplasty or stenting. During that COVID, please some 20 or 30 angiograms or 5 or 10 angioplasty. Then what happened? So the COVID cured all their chest pain. During COVID, what happened? Think carefully. Partly, I will put the blame on the patients, public. 90% of the chest pain, 90% of the chest pain has nothing to do with the heart. Chest is not only the heart. You have the chest wall, ribs, muscles, and the chest pain you may get from acid reflux or sprain. If you get a chest pain, and if it is chest pain around this area, 99% it is not from the heart. You say cartilage pain. All that you have to do is just press that area. And when you press that area, if you feel the pain, it's a reproducible pain, it is not from the heart. Or somewhere else also, you press with 2 fingers, pain is not heart. Take some pain pill like the paracetamol or some topical spray, pain spray, 3 or 4 days, will go away. But if you run to a hospital casualty, cardiologist, you will end up getting all those investigations and 1 to 2 lakhs angioplasty and stenting, unnecessary procedure. I have given you a very valuable tip, my dear friends. Listen to me. Take this advice seriously. The unnecessary stents, how professional inertia harms patients and wastes billions of dollars. I am dying from the treatment of too many physicians. Alexander the Great, he died when he was hardly 33 years old. That was in the BC era. Because he was an emperor. Oh, he was surrounded by many physicians. Just like the too many cooks spoil the broth. The same thing happened. That's why he made the comment, I am dying. I am dying from the treatment of too many physicians. So I repeat once again, it is worth repeating. Never go and see more number of doctors. More number of doctors is not good for you. Stick to one doctor. General medicine. Most of the problems, a person with the MD qualification, he will be or she will be able to diagnose. If that person thinks that is, you require an expert opinion, let that person refer you to a neurologist. Let that person take that decision. In the USA, the patients, they cannot straight away go to a neurologist, to a cardiologist or gastroenterologist. They have to come to a primary care physician like me. Only if I think that, okay, he needs more workup, and I refer. But in India, no. Just like that, you call, get an appointment with any neurologist, any cardiologist, any gastroenterologist. Dangerous. I think that I have made my point clear, crystal clear. Doctors are just the same as lawyers. This is Anton Chekhov was a doctor, Russian doctor, and a writer. Doctors are just the same as lawyers. The only difference is that lawyers merely rob you, whereas doctors rob you and kill you too. A sense of humor. So if you go to a lawyer, yeah, they'll rob your money. Everything will be gone. Go to a doctor, he'll rob you and he'll kill you. Be careful. Every Thursday, I give a talk. Upcoming talks, emotional traps, that is next week. After that, invisible enemies. Many people, they don't know who their real enemies are. Same link every Thursday. So, my dear friends, I believe that I have shared invaluable, insightful information. I don't think that many doctors will have the courage to give a talk on this topic. I have that moral courage because I was never greedy. I didn't make even a single penny by resorting to unethical practice. So that is why I chose to give this talk. It is worth watching this video once again and to share it with as many people as possible. If you want to, if you really care for your friends, family. Wish you all the best. Thank you for watching this video.